Arnold Leff. I'm the county health officer. I also function as the city's health officer. You all received the letter that I wrote a few days ago outlining a number of recommendations. Most of the recommendations are in process. The three major ones being to decrease the density of that camp as soon as it can be done, since the significant density really is a public health danger. The rodent control issue has just been spoken to, and I know that your Parks Director, Mr. Elliott, and our county's vector control are working together to find someone who can start to decrease the rodent population at the camp. And then the other issue, which is dear to my heart, is the issue of syringes. We have a large percentage of the people at the camp are injecting drug users and require from 300 to 600 syringes a day. And as a result, one of my recommendations is to allow us to provide those syringes. Currently, we have some individuals who get syringes at our facilities and bring them down to the camp. I would hope that the council would continue to support that and actually encourage those syringes to be available. That's a huge potential public health issue. As you know, approximately a year and a half ago, we had a very serious hepatitis A outbreak. Now, we've immunized thousands of people against hepatitis A, and I'm hoping that some of the people at the camp have been immunized. We are also bringing our medical staff to the encampment to vaccinate folks for influenza and hepatitis A when they're interested in doing that. So I'm here mainly to let you know that we are concerned. Obviously, the camp at some point needs to be closed. In the interim, any decrease in density would be helpful, and the need to deal with the rodent problem and the syringe problem you're in process of doing, and we are in process of doing as well. So I am open to any questions you might have.
Okay. Okay. Councilmember Glover and then Councilmember Crone.
Thank you, Dr. Leff. Just wanted to clarify, just so that there's clear understanding within the community. You had estimated 300 to 600 syringes per day. That's for the entire camp.
And that's an estimate. You know, we are presuming that and based on a survey that our Homeless Persons Health Project did, we're assuming about 50% of that camp is injecting drugs. We've distributed a huge amount of naloxone, which is Narcan, which is an overdose prevention substance. And but we're still concerned, because if people are reusing syringes or using friends' syringes, two major catastrophes happen, maybe three. One is you can spread hepatitis A, which when you spread hepatitis A, approximately 20% of it winds up in the community outside that nexus group. The second thing that happens is that you get wound infections. And those wound infections can be very, very serious, because they can eventually go to the heart and cause what we call endocarditis, or an infection of the heart. And Dominican has seen, unfortunately, a recurrence, or a resurgence, I should say, of valvular heart disease secondary to injection drugs. And the third major catastrophe, which is related to that, is that it cost tens of millions of dollars to deal with what dirty syringes bring to people that do not have clean syringes. Just the Emmeline Clinic, the 282 patients at the Emmeline Clinic cost the cost our alliance, our Medi-Cal program, $52 million in 2018, 282 patients.
Wow.
And the top 10 were half of that. So the reality is we need to deal with the syringe program. We need medically assisted treatment, which the county is doing our best to bump up and get to people so they can get medically assisted treatment on demand when they need it. But in the interim, for the encampment, rodent control, decreased density, and allow for as many syringes that are needed.
Thank you. And just one more question. In your professional experience and opinion, what is the most cost-effective and proven way to help people transition off of intravenous drug use?
Well, I think there's no one way. I think there's a number of ways. Medically assisted treatment with Suboxone, methadone treatment, which is a longer-term rehab, and then there's residential treatment for those that it's appropriate for. So, and there's a number of other things, but we can do it. Resources we're hoping are going to come in. Some resources are beginning to come in to deal with that population group, but they're a very, very vulnerable population, not only with substance use, but also mental illness.
Thank you, Dr. Leff.
Questions? I think, was there a question here? And then
Yes, my question, thank you. You already asked.
Oh, yes, okay, Councilmember Brown.
Sorry.
Hi, Dr. Leff. Thank you for being here. I used to sit up here with you years ago.
Yeah, I remember.
I was just wondering if you can tell us off the top of your head how many bed spaces there are available for residential treatment in Santa Cruz County. If not, we can get it. But I just want to get at the related to the potential need and interest, do we have sufficient bed spaces in your assessment? Because a lot of people tell us, well, we just need treatment, not all of this other stuff. And it's a little harder, it's a little trickier than that. It's more complicated and resource intensive. So
Yeah, I don't know that I know the beds, the beds today. I do know that we, the county, have participated in a state and federal program to get Medi-Cal to pay for residential drug treatment. And that program has just begun, really. It's sort of beginning to get going. Once that happens, you're going to see Janice is projecting to double the number of residential beds that they have for substance use treatment. But I could tell you we're going to need a significant amount more.
Any other questions? Thank you for being here tonight, Dr.
You're very welcome.